Nearly 70% of nursing homes in the United States are reporting lower staffing levels compared to pre-pandemic times. This persistent staffing shortage has led to concerns about facility closures and the overall quality of care provided to residents. How many nurses do you think feel supported in their roles? Hello, welcome back to Nursing on Another Level, and I'm Clistel Fields. Join me as I venture into the tough question: will nurses finally stand up and demand better working conditions for nursing home residents? Let's find out. Nursing homes play a vital role in our healthcare system, providing care and support to some of our most vulnerable citizens. And at the heart of these facilities are the nurses, dedicated professionals who work tirelessly to ensure the well-being of their residents. But despite their best efforts, nursing home residents often face poor living conditions. And it's time to ask the question, will nurses ever demand better? Nurses face a multitude of challenges when it comes to advocating better working conditions. For one, they often overworked and understaffed, leaving them with little time or energy to push for change. Additionally, speaking out can be risky, as they may face retaliation or be seen as troublemakers. And even if they do manage to bring attention to the issues, they may be met with resistance from administrators or policymakers who are unwilling to make changes. Furthermore, the nursing profession has traditionally been undervalued, with many nurses feeling disempowered and unsure of their ability to affect change. As a result, many nurses may feel that advocating for better working conditions is not worth the personal and professional risk. These challenges have a direct impact on the care provided to nursing home residents. When nurses are overworked and undervalued, they're more likely to make mistakes and quality of care suffers. Residents may not receive the attention they need, leading to neglect and even abuse. And when administrators prioritize profits over people, the very dignity of the resident is compromised. The consequences of inaction are severe, and it's imperative that we find a way to support nurses in their efforts to demand better. But it's not just the nurses who are affected. The entire system feels the weight of these challenges. When nursing homes are understaffed, hospitals and other facilities are forced to bear the burden, leading to a ripple effect of burnout and decreased quality of care throughout the entire system. The reality is that better working conditions for nurses in nursing homes would have far-reaching benefits for everyone involved. Staffing shortages are just one of the many factors contributing to poor working conditions in the nursing homes. Lack of resources, including outdated equipment, inadequate facilities, also take a toll on nurses. And systemic issues within the healthcare system, such as inequitable reimbursement structures and bureaucratic red tape, only exacerbate the problem. It's a complex web of challenges, and one that will require a multifaceted approach to solve. Another major factor is the lack of accountability and transparency in the system. When nursing homes can operate with minimal oversight and little recourse for residents and families, it's a recipe for disaster. And when government agencies and advocacy groups fail to hold these facilities accountable, the status quo is allowed to persist. The result is a system that prioritizes profits over people, and it's a system that desperately needs to change. One nurse who successfully advocated change is Karen Johnson, a gerontology nurse, practitioner. So she worked in a nursing home in rural America, Karen was horrified by the conditions she saw, and she knew she had to do something. She began by working with a small group of colleagues to raise awareness about the issues, and soon they were able to get the attention of local lawmakers. As a result, the state implemented changes to staffing ratios and increased funding for nursing homes, leading to a marked improvement in the quality of care. Karen's story is a testament to the power of nurses' advocacy, and it's a reminder that even one person can make a difference. Karen's success wasn't just about changes she brought about, it was also about the impact it had on her own purpose and fulfillment. When nurses are empowered to advocate for change, they're more likely to feel engaged and motivated in their work. And when they see the positive results of their efforts, it reinforces their commitment to the profession. The ripple effects of nurse advocacy are far-reaching, and they have the potential to transform the entire healthcare system. So, in summary, it's clear that better working conditions are essential for nursing home residents. Nurses play a vital role in advocating for these changes, but they face significant challenges in doing so. By addressing staffing shortages, lack of resources, and systemic issues, we can create an environment that supports nurses and ultimately benefit residents. Let's recognize the power of Nurse First. Thanks for watching, everyone. If you're a nurse who advocating change, we'll love to hear your story in the comments below. And if you want to learn more about health advocacy, be sure to check out my book, Nursing on Another Level, Enhancing the Healthcare System. It's available on Amazon and Barnes & Noble. Thank you.